standard weight loss goals often overshadow the immediate physical remodeling that happens during a workout. Elevating your heart rate sends an engineering command to your cells, initiating a real-time reconstruction of your biological architecture. This reconstruction is necessary to counter the degradation caused by a sedentary lifestyle. When the body stops moving, arterial walls become stiff and inflexible, and a waxy substance called plaque steadily accumulates, narrowing the space available for blood to flow. Inactivity also triggers the accumulation of visceral fat deep inside the abdomen. This is not passive tissue. It is a source of active inflammation that constantly stresses your vital organs. Research institutions like Massachusetts General Hospital approach this physical decline from a clinical perspective. Their data shows that movement functions as a medical intervention, evaluated with the same rigor applied to pharmaceuticals. The simple act of taking a brisk walk breaks this sedentary state. The sudden physical demand sends a surge of fluid through your system, waking up dormant cells and initiating an immediate biological chain reaction. This reaction cascades through the heart, the blood vessels, and the brain. It delivers a precise systemic impact that matches the effectiveness of a powerful cocktail of prescription drugs. The process begins at the heart. As your muscles demand more oxygen, the heart muscle is forced to rapidly adapt to the increased workload. This repeated demand increases the size of the heart's chambers. A larger chamber pumps a greater volume of blood, moving more oxygen with significantly less effort. This drives a 25% surge in blood, pushing massive amounts of fluid into the vascular network. The mechanical force of this blood rushing against the arterial walls triggers a critical chemical release. The cells lining your vessels begin producing a molecule called nitric oxide. Nitric oxide signals your blood vessels and capillaries to widen and relax. This flexibility creates a larger pathway for oxygen, carrying away waste more efficiently. Widening these pathways naturally drops your blood pressure. Movement achieves this through the exact same biological mechanism utilized by clinical hypertension medications. While the vessels widen, the skeletal muscles driving the movement act as a metabolic engine. They do more than provide leverage. They serve as highly active metabolic tissue. During a workout, contracting muscles churn out a protein called GLUT4. These travel to the cell surface to act as receptors, making the cells hypersensitive to insulin. They function like microscopic vacuums, rapidly pulling glucose out of the bloodstream for immediate energy. This consumption stabilizes your blood sugar and upgrades your metabolic engine. As the energy demand continues, the body begins burning through the toxic visceral fat that accumulates during periods of inactivity. The biological journey concludes in the brain. The physical stress of exercise creates a paradoxical effect, dampening the brain's chronic fight-or-flight stress response. Movement triggers the release of a neuroprotective protein called BDNF into the bloodstream. BDNF has a direct impact on mood and thinking ability. It functions as a powerful antidepressant, repairing neural pathways and protecting long-term cognitive function. Because chronic anxiety and mental stress are major drivers of cardiac events, this neurochemical upgrade serves as a top-down shield, protecting the heart from the damage caused by emotional strain. You do not need the training schedule of an elite athlete to trigger these internal changes. The American Heart Association defines the exact scientific dosage for heart health as 150 minutes of moderate aerobic activity per week, paired with 2 days of strength training. This can be achieved through exercise snacking, short accumulated bursts of activity, like taking the stairs or doing yard work. These small sessions are enough to trigger the full biological chain reaction. Every deliberate movement rebuilds the human machine from the inside out. This accessible biological upgrade shifts the focus toward internal maintenance, reinforcing the body's core systems every time we choose to move.